So now I will be introducing the final speaker on the formal agenda for today. Anyone who has met the CEO of Bridgepoint Health knows that CEO probably isn't an appropriate title. It just doesn't seem to capture what she's all about. If you combine energy, tenacity, and talent, I can't think of anyone better or better equipped to show the world how to create and build a better future for people living with complex chronic disease. For 30 years, she's been a passionate advocate for patients and change in the system. Please join me in welcoming the Chief Executive Officer and champion of the Bridgepoint vision, our CEO, Marian Walsh.
Thank you so much. You see, I was so excited that I almost forgot to kiss Tom, and that's like never allowed at Bridgepoint. We don't pass each other without a hug or a handshake or some warm greeting. But anyway, Tom, thank you very much. Minister Smitherman, affectionately known to us as George, and always will be. Councillor Fletcher, Peter, of course, the patients and the staff of Bridgepoint. I do really want to acknowledge you and all of our honored guests who are here today. We are gathered to celebrate, as the councillor said, an historic moment in the life of Bridgepoint Hospital in the rotunda of really an iconic building that was imagined by our city fathers 150 years ago. A building that was conceived to embody the aspirations of a small but prospering community and to stand as a symbol of transformation in prisoner care. Like those who stood here before us, we too are about to break ground on a building that embraces a daring new vision of ourselves. For me, and I know for all the staff of Bridgepoint, and many of you here today who've actually had a direct hand in making this project happen, the excitement is actually palpable. In the summer, we signed contracts to build the new Bridgepoint Hospital, a hospital that will allow us to transform healthcare for the growing number of Ontarians who are living with complex and chronic diseases. And in so doing, we affirmed our commitment to change the way we deliver care, to create new science, to develop new curricula, to forge new relationships with innovators in the field, and become the leading provider of complex medical care in the country, and in effect, to chart a new frontier in healthcare. At the time, I thought the contract signing was pretty exciting. We're on the 50-something floor of McCarthy Tetro, and there's like this big, long boardroom table. But let me tell you that putting your signature on a piece of paper is not the same as actually digging a hole in the ground and then watching the cranes roll into sight. I think all of you who are the patients and staff will know what I mean when I say that ever since the construction crews arrived, you can feel the energy around the place. The air has been positively electric. And it's a bit ironic, I think, that we've got all these construction workers who've arrived at Bridgepoint. They're making noise, they're raising dust, they're tearing up our cafeteria, and today they moved our parking. And yet we're practically skipping down the corridors with glee. We're overjoyed, obviously, because we can finally see that this building, the new Bridgepoint Hospital, is really happening. Today's groundbreaking is a pivotal moment for us because it represents the tangible realization of a big dream. Just as in its time, this Don jail was the realization of a big dream. Toronto was only a city of 40,000 people in those days, and I'm sure that when the city fathers proposed building a huge, iconic piece of architecture to house prisoners, some people thought they were dreaming in Technicolor. But in my experience, big dreams make things happen. And I think many of you in this room share that view. And the new Bridgepoint Hospital has been an extraordinary collaboration of many big dreamers. Our new hospital has gone from dream to drawing board and is now becoming reality because of the visionaries on the board of Bridgepoint Health, in the Ontario government, in the Ministry of Health and Long-Term Care, the Ministry of Energy and Infrastructure, the City of Toronto, and also because of the bold imagination and the focus and the commitment of the staff of Bridgepoint. We've reinvented ourselves, as Tom alluded to, many times over the last 150 years, and now, on the eve of our 150th anniversary, we have many compelling reasons to reimagine ourselves anew. We now know that 70% of what we do in healthcare goes way beyond saving lives. People are living with their illnesses, that's the good news, rather than dying from them, which is why the World Health Organization has declared chronic and complex illness as the #1 healthcare challenge of the 21st century. This is also why we at Bridgepoint are committed to transforming ourselves to respond to this new reality by designing approaches to care that will help people not just to live, but to live well, and a building that inspires and encourages them to do so. The Don Jail, where we now sit, was a stunning wedding of form and function. Likewise, our airy, light-drenched new hospital, which has already received architectural awards, will combine state-of-the-art technology and care with a warm, inviting, health and wellness promoting environment that will epitomize the future of healthcare. In a moment, we will go outside and put shovels in the earth to break ground for the new Bridgepoint Hospital. And before we do, I just want to take a moment to savor the meaning of this occasion for us at Bridgepoint and beyond. First of all, for the thousands of Torontonians with complex chronic disease who are caught in the cycle of acute care emergency rooms and alternate levels of care, it means that more of them will have the opportunity to break that cycle because of the new knowledge that we will generate through research and the new model of care that we have at Bridgepoint that is designed to equip people not just to live with sickness, but to manage that more effectively on their own, independently, in their own living environments, as George alluded to earlier. Beyond our borders, this project will quite literally transform the corner of Broadview and Gerrard, and in so doing, irrevocably alter the landscape of Toronto. It will contribute in countless ways to the health and prosperity of our city and our community, and represent a sea change in the way we imagine the future of healthcare itself. Here at Bridgepoint, for all of us, and all of you in the auditorium too, we now need to realize our full potential and provide a return on the considerable investment that others have made in us. Over the next few years, our task is to shift into high gear, to transform ourselves in the way we treat patients, so that when moving day arrives, we can hit the ground running and truly change the world for people with complex chronic disease. No doubt, there will be a few challenges along the way, but right now, our only job is to imagine the future, celebrate all that we have accomplished, and then go outside to break ground for the new Bridgepoint Hospital. Ladies and gentlemen, welcome to the new Bridgepoint Hospital.